Good afternoon, everyone. Thank you for joining us this afternoon for our weekly press conference on Delaware's response to COVID-19. I'm joined today once again by Dr. Carl Rattay, the exceptional director of our Division of Public Health, and Dr. Hong, who's here as part of her team, the medical director for the Division of Public Health. Dr. Hong has some really interesting, great news to talk about with respect to vaccinations. And then our stalwart, AJ Schall, the director of DEMA, Delaware Emergency Management Agency. He's been doing a great job heading up and steering our testing effort, which has reached incredible heights over the last couple months and continues to do an outstanding job. And will be very helpful as we look ahead towards vaccination and testing at the same time, which will challenge all of us, but I know our team is up to the challenge, as well as our partners across the state, the hospitals, the first responders, emergency response folks, firefighters across the state, just doing an exceptional job. Really another shout out to our frontline healthcare workers. Those at the hospitals are just doing an amazing job. All the first responders across our state. We're almost 10 months into this unprecedented COVID-19 pandemic, and our people are still responding with compassion, with concern, and with more effective medical treatments today than certainly at the beginning. We have some new things to talk about. We have good news and bad news. The good news, of course, everybody's aware of. The vaccines have arrived here, and vaccinations are taking place initially with our 1A group, which are hospital workers. The hospitals have been vaccinating their employees, and we got a report on that. Yesterday, Dr. Hong's going to talk a little bit more about how that's going and looking ahead to other subgroups. We have a new website, and we'll go to that as the first slide. It's intended to be easier to work with, give you the information that you need to follow the spread in our communities, the number of positive cases, the percent of tests that we're doing that are positive, the current hospitalizations, all the data that we run through on a weekly basis, and the data that enables you to have a sense as to what the status of the COVID-19 spread is in the state of Delaware and communities in our state. It's broken down by city and town, by county, by zip code, by House of Representative and House Senate districts, and really a tremendous information there. And we invite you to go on the website and give us feedback about what you see. My Healthy Community, of course, is the link that we're all using to track the data. Let's go right to the data. So there it is, well over 50,000 total positive cases since the first case back in March. Sadly, 800, almost 900 total lives. Everyone a precious life. So many our seniors and vulnerable citizens of our state. The bad news is hospitalizations continue to go up. We've reached another peak there at 433 current hospitalizations yesterday. 61 are critical. We did have a meeting, as we do each week, with leaders of our hospitals across our state, really doing an excellent job managing the census in their hospitals. And we'll talk a little bit about that. While the hospitalizations for COVID are up to the highest peak since March, overall census in the hospitals is about flat. AJ will talk a little bit more about that as well. So the good news is we're managing it. The bad news is that it's at a level higher than we've seen. Not as many people on ventilators is the response that we get from the hospitals. That's a good thing. Obviously, you can see 61 of those that are hospitalized in critical condition, something obviously we take a look at. So how do the cases break down? Almost 30,000 positive cases in Newcastle County. Kent County, where we've seen earlier on the best situation, now leading the way, unfortunately, over 8,000 positive cases as a result of increased awareness to the surge in cases there. We've had a higher level of testing down there, which is a good thing. And It seems like things are leveling off in Kent County as they are, hopefully across the state, 13,000, almost 14,000 positive cases in Sussex County. Sussex County, if you remember, back in April, May, we're kind of had the highest concentration of positive cases associated with hospitality industries in the beach communities. Did a really, and in the poultry industry, a really intense effort to test and quarantine and isolate those that are tested positive in those communities, and we're able to push down that surge there. And we're trying to do that across our state now. If you look at the next slide, you can see the percent of persons who are tested. So these are individual Delawareans who are tested as opposed to people who've been tested more than once. That number's now in the 7-day moving average is under 10%, just above 9%, kind of flattening out there, good at a level. We want to be at 5% or below. That's the target. So we have a ways to go there, but things are flattening out a little bit. And we hope that that's the trend as we move into the Christmas holidays, because we know that people are going to be getting together and already seeing a lot of traffic as people do go about their Christmas shopping. And we would advise folks to be very careful about that. Make sure you're wearing your mask, keeping social distance, or there's limited capacity in retail establishments. Make sure you follow the guidance there so we can prevent unnecessary spread. There's no necessary spread, but unfortunate spread throughout the community. We're down to a 7-day moving average under 700 at 645. We're up to over 800 there for a while. Here's the test base versus the person based testing numbers. We've tested almost 500,000 persons, so individual Delawareans, and we're over 900,000 total tests administered. So you can see the difference there with respect to the calculation for the percent positive of folks that are tested, which is the one that we look at. That's the 9%, 9.1% on a 7-day moving average. This is the rate of positive cases. Again, that young adult subcategory still leading the way. The next adult category, 35 to 49, in second place there. All those who are in those categories, particularly our young adult, it's possible that, and maybe likely that you have COVID-19 and you don't have symptoms. You should make sure you're getting tested. And we have some testing sites out where we're doing the quicker result test, the antigen test. AJ is going to talk a little bit about that to try to target these populations to make sure that they're not spreading the virus, even though they're asymptomatic to others in the community, particularly to our more vulnerable citizens. So let's look at our COVID-19 data dashboard. You can see on the top, to the top left is your current hospitalizations. That's the number we really look at. We know those people, the hospitals count them every day. There's 433 of them yesterday. We know once we get over 400, we're in a bit of a danger zone, if you will. Hospitals know that too, and they're managing those populations, doing fewer elective surgeries, emptying out the hospitals to the extent possible. And their overall census rate at the moment is pretty flat. And so they're able to accommodate those additional hospitalizations. That we will continue to look at that number. That's a lagging indicator, and likely the lag that we're seeing from the surge in positive cases, Dr. Rattay is going to show in a minute, that followed the Thanksgiving holidays and family and social gatherings that occurred over Thanksgiving. So several weeks down the road, you're seeing the people that are getting very seriously ill and need hospital care. We know that the hospitals report that they're moving people in and out of the hospitals more quickly than they did back in the spring. They're treating them more effectively. We have an effective treatment that, and we're getting those monoclonal antibodies distributed to the state and out to the hospitals. They've put those in effect, and they're treating people across our state. So if you're in that very vulnerable population, you're a candidate for that. AJ and his team are trying to get folks tested right away when you have those symptoms, so that we can get you on that treatment as quickly as possible, and hopefully avoid the need for hospital care for those vulnerable citizens. You can see on the middle chart on the top that new admissions to the hospital are trending down. That's a good thing, and an indicator that the hospitalization rate might follow in the days ahead. New positive cases, as you can see, are trending down in the right direction. 7-day moving average, you can see the orange line, if you will, goes up and down. The 7-day moving average is the blue bar underneath. The bottom level, the far left and the middle are our percent positive calculations. Obviously, the percent of persons that are tested positive on the bottom far left is at a much higher level, a little bit below, right around 20% now, I think it is. And then in the middle, the 7-day moving average for tests that are positive at just below, just right around 10% or 9%. So if you look at all the available data, now you can see this emerging U-shape, particularly in new positive cases and hospitalizations, really demonstrates well visually what we've seen over the last 9 months since the first cases back in March. The surge in hospitalizations we saw at the end of April as a result of those initial positive cases, the peaking that we saw at the end of May and into June, and then better conditions as we went through the summer, and then the uptick in September and in particular coming out of the Thanksgiving holidays. All those graphs are 90-day looks at it's all the available data going to when we first collected it. I correct myself there. Not just the 90-day. And so you can see the run up on the percent of tests and persons testing positive, and then the kind of U-shaped as we move into this fall surge. What we really need to focus on, and our major message today is, we've seen the surge out of the Thanksgiving holidays and family celebrations and social activities. And now we anticipate families getting together again. We've had the Hanukkah season. We're coming into Christmas season. We know that families are going to get together, and we just cannot afford to have another run up in positive cases and hospitalizations on top of the run up that you can see now on the top far right. All the graphs, the U-shaped graphs on the top, current hospitalizations far left, new positive cases far right. We just can't afford to have that same effect from the Christmas Hanukkah season that we're moving into on the Christmas side. So the data dashboard on personal protective equipment, we're looking really good. AJ, it's a good sign as we fight the surge from Thanksgiving and as we prepare for another potential surge. Here's the graph that illustrates it so well, with the surge and the peak back in May, and then the improving conditions as we moved into the summer season after Memorial Day, kind of our reopening that occurred there in business establishments. Really the good days as we were fighting the virus through the summer, through June, July, August. And then as we moved into the end of September, into Halloween and Thanksgiving, you can see the run up in positive cases. This happens to be hospitalizations, which lags by a week, 2 weeks, maybe 3 weeks behind the initial run up in positive cases. Just look at the dates. We went from November the 2nd to 107 people hospitalized for COVID-19 to the 1st of December, almost tripled to 306. And now running up through just 3 weeks in December from 306 to 433. Again, our hospitals across our state doing a really good job managing their census, making sure that they have room to treat those who are coming in. New treatments with monoclonal antibodies, very effective and moving folks through. So that's the bad news. The good news is help has finally arrived. The cavalry is here. It's been on the horizon now for the last couple months. They have arrived with the vaccinations. These are our photographs of our frontline hospital workers, the first to get vaccinated. And I know how pleased they were to be able to lead the way. They've been standing on the front lines, fighting for all of us for so long, doing just an exceptional job, putting themselves at risk, following our guidelines for sure in terms of protective equipment, social distancing when they can, super mask wearing, all those protections, but handling COVID positive cases, treating COVID positive cases, working with others that come in who aren't, maybe don't test positive, but as I heard one nurse say last week, that she approached every new patient as potentially COVID positive, which is the way we all need to think about our activities in our communities and with our families. Not only do we have vaccinations on the way, but we have additional resources that we're putting into Delaware relief grants, another 26 million. We did get good news this week from the Congress of the United States passing legislation for additional resources. We'll get the details and we'll share that with you next week, but we are putting some of the first round of COVID relief funds from the federal government. Thank you to Senator Carper and Senator Coons and Congresswoman Blunt-Rochester for that and their colleagues on both sides of the Capitol. A new round of relief funding, another 20% bonus for the original relief grant recipients, and importantly, another 50% bonus for hospital businesses, so hospitality businesses. So that includes bars, restaurants, all those businesses that have already qualified. They've gotten their initial assistance. They've gotten their initial bonus payments. And now here's an additional 50% that we're putting on the table to really help them get through this latest reduction in the capacity that they can serve in their bars and restaurants, and the curfew that we put in place at 10 o'clock, recognizing that. And these businesses have gone above and beyond with respect to the sacrifices to keep the rest of us safe by preventing spread of COVID-19 in their establishments and lost incredible amounts of revenue. We've stepped up to the plate to help them, the taxpayers that is, with these federal monies. And so nearly 300 Delaware businesses have been supported through this program and will continue to be supported. And when you add the initial support and the bonus payments, including the 26 million we're talking about now, almost $200 million in total grants to help these businesses stay alive, because they're such an important part of cities and towns across our state. We also have $10 million in relief for arts organizations. Again, those that have been helped all along. A great idea to salute and to thank our healthcare heroes across our state, coming out of the city of Newcastle, Mayor Mike Caranta and his council, to celebrate these frontline health workers on Christmas Eve, December 24th at 6 p.m. Everybody's invited to come out of your house, onto your front step, and ring bells. So ringing bells to celebrate our Delaware healthcare heroes, so that everybody across our state can join in this activity, can kind of feel the love for our healthcare heroes, the incredible things that they've been doing for all of us and continue to do and will continue to do as they help us, the rest of us, get vaccinated as our number comes up. So ringing the bells, remember, pass the word, December 24th at 6 p.m. Be out on your front porch, your front steps, and ring those bells for our healthcare heroes. You can find information at hashtag #RingingBellsDE, hashtag #RingingBells with an S, DE. We do have a universal indoor mask mandate in effect. People say to me all the time, what do you mean an indoor mask mandate? Well, you want to protect yourself, particularly from those who might be visiting your house from another household. We discourage that, but certainly make sure that you're wearing a mask even among a household. If you've got folks that are going out, circulating, going to the store that you have to do, going to pick up groceries, going to your doctor's appointment, whatever those essential activities are, limiting those trips out into the public so to protect yourselves and to protect other family members. And when you're indoors, whether it's in your home or in a business establishment, in particular when you're in a business establishment, make sure you have your mask on. As I travel around, most people are doing it. I know the business establishments have signage, they're enforcing it, and by and large, overwhelmingly, Delawareans are stepping up to the plate, wearing a mask when they're outdoors, when they're indoors, and that's the best thing that you can do. I know we've had some difficult public health questions, and Dr. Fauci apparently got some difficult questions about Santa Claus and whether or not he may have been exposed to COVID-19. We do know he's in that elderly, vulnerable population. Dr. Fauci is telling the children on Sesame Street that he has reached out and vaccinated Santa Claus. So Santa Claus has been vaccinated. It's safe for him to come down the chimney and visit your house. Little ones and the children that might be watching, those of you who have children, you can tell them that Dr. Fauci is telling the kids on Sesame Street that he's vaccinated Santa Claus. We're asking and really imploring every Delawarean to really think carefully about how you celebrate Christmas this year. We know that folks bring family members together. It's an important holiday, religious celebration for so many of us. It's a time where we exchange gifts, we show our love for one another. But this year, it's a time where we have to be safe. We can't afford to have another surge on top of the surge that we had coming out of Thanksgiving. And we'll see when Dr. Rattay walks through her slides, the run up in hospitalizations that we saw to 433 yesterday. We cannot have another surge of 200 or so on top of that coming out of the Christmas holidays. Again, our hospitals are doing an exceptional job managing their overall census in the hospitals. So that if you look at overall, even with that surge in new hospitalizations, it's fairly flat over the last several weeks of December. But we can't afford, they can only do so much. And we can't afford to have a surge in hospitalizations on top of the surge that we've had. We can't afford the surge in positive cases that we saw on top of the surge that we had at Thanksgiving. So celebrate safely, avoid family gatherings that bring people from different households together, and wear masks when you're in contact with others outside of your household. That's our message today. Good news and bad news. You're going to hear more about the good news from Dr. Hong and vaccinations. Help has arrived. You're going to hear some good and bad news from Dr. Rattay. We need to be vigilant. We need to be safe. We need to celebrate safely and take care of our individual family members, particularly our elderly aunts, uncles, moms, dads, grandmothers, and grandfathers. Dr. Rattay?
Thank you so much, Governor. So, as usual, I want to start with our areas of concern in the state. As we've seen over the past few weeks, no part of the state is left untouched. You may notice that we have a few less zip codes this week that meet the criteria. And that goes along with the data that the governor was showing that our case rates have stabilized to some degree. However, we do see some areas that have seen some increases. Delaware City is one that showed the most increases in cases, the highest increases in cases over this past week. So in Delaware City, they have over 1,100 cases per 100,000 people, which is one of the highest case rates we've seen, and a 36% positive rate. So really want to encourage people in that area to make sure that they're getting tested, as well as in Newcastle, Townsend, Frankfurt, and Selbyville. Those are our highest areas this past week. We also saw in Deggsboro, Greenwood, and Bridgeville some increases this week. While we saw some decreases in those areas, some of those areas just south of the canal, not all. But for the most part, we really still have very high levels of community spread in the state. So let's turn our attention to going back a little bit to Thanksgiving, as we're now thinking forward to the upcoming holidays, or in the midst of our current December holidays. We have some important lessons to learn from the data surrounding Thanksgiving. So when you look at this slide, you can see inside that inner circle there, just a real significant increase. And this is percent positivity, but we see something very similar with case numbers and case rates in the days following Thanksgiving. So we saw a significant surge after Thanksgiving. And as the governor has said, the hospitalizations we're dealing with now really are in large part a reflection of that surge. We also saw in our cluster data, so when our epidemiologists identify, for example, a common address or a common event, they'll dig into it. A number of Thanksgiving dinners, Thanksgiving parties, Thanksgiving gatherings, where numerous people from those gatherings, in some cases more than 50% of people who went to Thanksgiving dinners became infected. So really shows two things: how infectious this is, especially inside, but also large gatherings are truly a big concern. And if you think about it, then people leave those gatherings, they have symptoms a few days later, or they don't have symptoms, and they go on to other parts of their life and they spread it in the community. So from our school reports, as an example, we saw repeatedly cases for staff and students who became exposed or infected related to Thanksgiving events. So, a number of the ways we look at data showed Thanksgiving was really, a super spreader day for us as a state. And so let's go on to the next slide and talk about how to be safe over this holiday. As the governor has said, and it's the most important message we have today, we cannot afford another surge on top of the Thanksgiving surge. Our hospitals cannot take that increase in patients again. And so we continue to recommend only gather with those who currently live with you during the holidays. And we hope that most people do follow that guidance. But we also know, and we saw at Thanksgiving, we had the same guidance then, and we saw that numerous people didn't follow that guidance. Now, in some situations, it's of course very logical. If you have adult children who are coming home, of course that you want to have a place for them to come home to. You might have Aunt Sally who's all alone, and you don't want her to spend the holidays alone. So what we use a term in public health we call harm reduction, which is kind of like if we give advice, don't binge drink. But if you're going to binge drink, which of course, is not great for your health and is not safe, but if you're going to do it, make sure you have a designated driver. So in a similar vein, if you are going to gather with others, you've got to consider some factors, and you need to put some mitigation strategies in place, and you need to have some tough conversations. So back on the previous slide, consider who are the people that you're thinking about having come to your house or spending time with. are they at high risk themselves? Are they at high risk of consequences? We know this has been a tough time for people with chronic diseases and people who are older. But this is really not the time to let up our guard when vaccine for them is just around the corner. Additionally, think about the risk of, those who haven't been abiding by mask wearing and social distancing, because they're going to really increase your family and others if you spend time with them. Last week, we said, go ahead, as of last Tuesday, if you're going to spend time with other people, to go ahead and start quarantining. We hope that many people did do that. Then the guidance is about 3 days before you're going to spend time, everybody should be tested. Everyone should be tested so that you know the results before you come together. And if anyone's positive, then you don't come together. But on the next slide, the other mitigation strategies include, as we mentioned, make sure if you're going to have people come together, keep the number extremely limited. Very much limit the number of people. These large gatherings are a recipe for a lot of spread. Governor already talked about it. It's not comfortable, but we need to wear face coverings when we are inside, especially when we're spending time with people outside of our households. That means if you're hanging out watching a football game, you need to be 6 feet apart and wear masks when you're around anybody else who's outside of your household. And those are tough conversations that we have to have with people if we're going to spend time with them. If people are dining, that's one of the riskiest behaviors, right? Because people don't have their masks on. Best thing to do is have non-household members that dine in separate areas, maybe separate rooms. We've talked about ventilation before. We know that it's probably not realistic for people to dine outside and spend time outside right now. But at the very least, open windows, get some ventilation, open doors, get a fan blowing outside of a window to keep circulation going. And it's part of the conversation to have with people. Bring some extra layers. It might be a little chilly in your home. And then in addition to that guidance, if you have come together around other people, you need to quarantine in the days afterwards. Act as though you've been exposed to somebody who's positive, quarantine for a good 7 days, get tested 5 to 7 days after, just to make sure you're not positive so that you don't spread it in the community. So again, we are very concerned about the impact that the holidays may have on people. And we don't want to rain on people's holiday parade, but we really implore, are pleading with all of you to please be very careful and don't spread this virus over the holiday. And with that, I will hand it back to you, Governor.
Thank you very much, Dr. Rattay. Some really good advice there. There is some detail to it, so I recommend that you study it carefully, use it as a way of working safely through the holiday celebrations to protect your family, yourself, particularly elderly parents, grandparents, and other relatives. Dr. Hong is here to talk about some good news. Vaccines have arrived in Delaware. Dr. Hong, our frontline healthcare workers, hospital workers are getting vaccinated, and it's a really good thing. Dr. Hong.
Great, thank you, Governor. So here I want to give you an update what's been going on with vaccination. As many of you guys know that, we received a vaccine last week, and we received our first shipment of Moderna this week. So we have both types of vaccines, Pfizer as well as Moderna here in the state. And again, looking at pictures of our frontline workers, our healthcare personnel that have received the vaccine thus far. Again, heroes every day and heroes in getting the vaccine. Next slide, please. So just general vaccine update, total vaccines administered 3,872. Again, the majority of those doses were administered by health systems. We did provide vaccines to some long-term care staff as well and other frontline workers. Very excited to hear that Moderna was approved by the FDA as well as the CDC. So we have received some shipment of Moderna yesterday. We expect more today. And we will begin to vaccinate using Moderna. So very excited about that. So arriving this week, and I said already that we did receive some shipments yesterday, total 16,700 doses of Moderna this week. Many of them were shipped directly to hospitals and FQHCs as enrolled vaccine providers, with the remainder to DPH, Division of Public Health, for our EMS folks, and as well as for other settings as well too. We also expect 2,925 doses of Pfizer that will be shipped directly to hospitals. This is the remainder after we have banked for the federal pharmacy program with long-term care facilities. So, these numbers, we're very excited with these numbers. We do get an idea what our weekly shipments are going to be. But again, these numbers are very dynamic, and sometimes they go up and sometimes they go down. So, we will not know for sure what doses we're getting until we put that order in. So we will be as transparent as possible by providing those numbers, but we want folks to understand that these numbers may be for planning purposes only until we know for sure what we're getting and what we're ordering. Next slide, please. So just kind of summarize Pfizer, Moderna, many similarities, but there are some nuances and differences between the two. Not talking about the storage requirements for Pfizer with ultra cold chain, Moderna, just refrigeration, but looking at there are age differences for use. For Pfizer's currently approved for ages 16 and older, and Moderna currently approved for 18 years and older. And both of them really had that concern if you had a severe allergic reaction to any injectable medications or other vaccines. But in particular, if you had a severe allergic reaction or any reaction after a previous dose, then you really should be concerned whether you should be eligible for this vaccine. So if there are any concerns such as pregnancy status, or if you're breastfeeding, if you are immunocompromised, and again, immunocompromised just regarding how effective the vaccine is going to be, immunocompromised states are considered at risk medical conditions, so should get the vaccine. But again, please talk to your physician as well if you have any allergic reactions to other vaccines. So again, these items listed are not necessarily absolute contraindications and that you cannot get the vaccine, but I think it just warrants further consultation with your personal physician or provider, further guidance as well to make sure that this is the right choice for you. There is some difference between the time frame for the second dose. As you can see here, for Pfizer's 3 weeks apart, and for Moderna is 4 weeks apart. Two questions I do want to address on this slide that I've received frequently is, number one, if I've been positive before, should I still get the vaccine? And number two, if I get the vaccine, does that mean I don't have to wear masks or face coverings and do all those infection control measures? So the answer to question number one is that you should still get the vaccine even though you've been positive before, that there is some level of natural immunity, but we don't expect that to last long. CDC is using the 90-day window as the level of natural immunity. So again, past that 90 days, we don't suspect you may have the immunity afterwards. So the vaccine is still warranted. So just again, this is a reminder that if you are currently positive and you are supposed to isolate, you should complete your isolation before you consider getting the vaccine. We don't want any positive cases to potentially transmit a disease to others who might be waiting for the vaccine. So there's no urgency if you're currently infected to go out and get the vaccine right then and there. There is that currently 90-day window for natural immunity. So you have some time before you really need to get the vaccine. So just want to remind folks is not just, break isolation, that we still we need positive cases to complete the isolation period before leaving their homes. And also to question number two, do I still need to do everything such as wearing face masks and social distancing and hand hygiene? The answer is yes. Even though if you complete the 2-dose vaccine, that we still urge folks to continue practicing these infection control measures until we reach a certain level of herd immunity, as such that we definitely see a decrease in transmission. So please keep up the good work, what you're doing now with your infection control measures, especially as the governor mentioned regarding the indoor mask mandate as well as social distancing. Next slide, please. So there are potential side effects, and we've heard in the news some side effects that were unexpected and on the severe side. However, still there are side effects that are considered mild and typically lasting for about a day or two. Talking specifically to Moderna, 21% of recipients appears to be a little more common than with Pfizer, especially after second shot. And again, with Pfizer as well, we did see reports of more side effects after the second shot. They are considered unpleasant, but still mild, potentially moderate, and it goes away after 1 to 3 days. We did notice in Moderna that they're more frequent and stronger persons age 18 to 64 years than in those aged over 65 years of age. But really no specific safety concerns identified in subgroup analysis, whether you look at age or race, ethnicity, underlying medical conditions, or previous infections. So very similar side effect profile that we're seeing in Moderna as we are seeing in Pfizer. So we've been, just kind of wanting people to know that you might get some side effects, but please don't let that hinder you from completing the series. Really, you need both doses to get the full impact of the vaccine. The one dose may not last as long and may not be as effective. So again, if you're going to go through with it, please consider going through both shots, again, to get that maximum effectiveness. Next slide, please. So this is our phased approach to vaccine allocation. And just, we are currently in phase 1A, so we are focused on healthcare personnel as well as residents of long-term care facilities. And that's going to be lasting potentially up to 2 months or maybe even longer. And all this is dependent on the supply that we receive. You notice in phase 1B, this is proposed because ACIP, or the Advisory Committee on Immunization Practices, recently submitted final recommendations on allocation groups 1B and 1C. And our ethics group will be meeting today to kind of review their recommendations as well as determining how we should approach in Delaware. I'm excited, though, to see how ACIP's recommendation has evolved since a couple weeks ago. Right now, they are balancing both the critical infrastructure workforce as well as those at highest risk for disease. And that's the approach that we were taking. So I'm glad that we are aligned in that approach. So, phase 1B is still under proposed. And there might be a phase 1C as well. We're not sure. But regardless, we can say with the remainder of phase 1 that we are going to be addressing non-healthcare essential critical workforce, as well as those with certain chronic medical conditions, as well as those greater than or equal to age 65. So more to come on that. And then you can see afterwards, we haven't really discussed phases 2, 3, and 4. But of note, again, reminding folks that when you see this chart, you notice that it is not a domino effect where you have to finish 1A before you can start 1B, that there's an overlapping effect. And there are many reasons for that, but one of the primary reasons is to reduce waste. We want to make sure that if you happen to have extra doses, as we're hearing in the news, or you have more doses than you have people to vaccinate, that you have an opportunity to vaccinate others, because we really don't want to have any waste. So this overlap approach, it does give us that flexibility to be able to maximize the number of people to vaccinate. Next slide, please. So again, to review what the ACIP recommendations are that were decided over the weekend, they identify phase 1B as for adults 75 years and older, as well as certain frontline essential workers. And then phase 1-3 will include persons aged 65 to 74 years, as well as person aged 16 to 64 years with high-risk conditions. As well as anyone left over from the essential workers that were not recommended in phase 1B. So it's very similar to what we proposed for R1B. Again, we will review those recommendations within our ethics advisory group and then provide formal recommendations to the director's office. Next slide, please. Just some data nationally, the CDC Data Tracker. Total doses distributed is 4,624,000. And then dose administered 614,000. So we're getting there. We will have our own data tracker, and that will be visible through My Healthy Community once it is up and running. Next slide, please. So a reminder, we did set up a call center last week. So the numbers up there is 1-833-643-1715, and it's available Monday through Friday, 8:30 to 4:30, and Saturday, 10 to 4. You can call 211 as well too, or text zip code to 898-211. But really the most convenient way to get information is really looking up at vaccine@delaware.gov. To email vaccine@delaware.gov, and then one of our representatives can respond back in an email format if you have that capability. But again, just a reminder that we do have a vaccine website that does have the most updated information. So please access that website as well too to get that information. But you have various ways to get that information. Again, please consider talking to your personal provider, as well as using this call center, the email address, as well as our website.
So thank you very much, Dr. Hong. Really exceptional work there. A plan that's underway. The vaccine has arrived. Frontline healthcare workers, Group 1A, are getting vaccinated. Thousands already have gotten it. Report back from the hospitals yesterday. Overwhelming response from their employees. Really good news. Lots of folks to vaccinate over the next year, really 6 months for sure. Certainly, as we run through the prioritization list, getting to most vulnerable populations, our essential workforce, critical infrastructure, as you said, a plan that will continue to evolve. We'll use our regular vaccination methodologies with primary care and with our pharmacies, with urgent care. And obviously we know that there are hard to reach populations that we've got to be conscious of, and we will, and that'll be part of our plan. So really great work getting off the ground well and well underway with our healthcare frontline workers in the hospitals. AJ, tell us a little bit about testing and how we're doing. Sounds like we're doing well. We've got some new things hitting the ground to try to get to certain populations, and really important work that you're doing.
No, thank you, sir. And definitely exciting moves on testing. We'll get through that in a minute. But going into Christmas week, we all knew it was going to be an important time for people to get tested. As Dr. Rattay mentioned, probably time's already passed if you're going to be seeing those that may be at risk. So this week we have 23 sites between Newcastle County and Kent and Sussex. These are all in addition to the Walgreens State Service Centers and clinics that are doing testing Monday through Friday or 7 days a week, depending where you go. As I mentioned last week, we did launch 6 additional Walgreens as well. So ample opportunity out there right now for people to get tested. A reminder, go to de.gov/get tested for the most updated information. There are times that we have had to cancel. If you looked last week with the snowstorm, we closed a few sites early up in the northern part of the state. So we'll push it out there and update it, as well as our Division of Public Health's website, as well as DEMA's, so people know the most updated status. So Newcastle County is going through this week. There's limited testing Thursday and none on Friday with the holiday. Kent and Sussex, we have 6 in Kent this week and 5 in Sussex. This actually today for another 5 hours are down in Rehoboth Beach at Epworth Church, which has been one of our superstars down there. And then we're on the other side of the county a little bit later on this week as well. So go to delaware.curativeinc.com to sign up for any of those sites and reserve your spot. It makes you go quicker as you get in line. You don't have to provide your information again. Pull up your confirmation number, you get your kit, and you're in and out within a few minutes. Last week, again, continue to keep my word of saying we thought 80,000 was a lot to get done in a month. So 2 weeks ago, we did 53,000 tests across the state. Last week, we did 60,000, and this is just a huge number if you think about the day that we had very minimal testing because of the weather events. This tells me 2 things, that our community testing is successful, but we're also seeing additional partners coming online, providing testing through other methods as well, whether it's other pharmacies outside of the partnership we have with Walgreens, other labs and clinics, the walk-in centers, et cetera. So there is a large number of partners across the state that are making this successful. We know this is kind of one of multiple things that we have to do to beat this and keep us safe as we head into the home stretch now that the vaccine is here. But it will be a long home stretch, as Dr. Hong indicated. Finally, kind of something exciting that we rolled out yesterday. We talked about this last week, and it's one of those things that we've said it a lot this year. We're building the plane going down the runway. The rapid antigen tests. So these are not the PCR tests. These are antigen tests that provide results within about 15 minutes to individuals. We do have some additional steps that somebody takes if they are positive. We follow up with a PCR. Yesterday down at Dover Del Tech, we tested about 400 people over about 6 hours. Once they checked in and did the test, they got the results in about 15 minutes. Because of the check-in, providing the instructions, and then waiting for the results, it's not one of those testing modalities that we could go ahead and do 1,000 or 2,000 people a day like we've seen with some of our other drive-throughs. So what we're doing now is we're paralleling this. So today down at the Laurel Service Center, and then tomorrow in Dover, we'll be using some of our normal facilities. We're doing testing at the state clinics and identifying those that are at high risk, either have symptoms, they're over the age of 65, or they're in that 18 to 35 range bracket that have already made a reservation, but we know could either may need healthcare assistance earlier than later for those over the 65, or maybe those that are asymptomatic and maybe spreading it without knowing it in that 18 to 35 group. So we're going to try and parallel it, do it that way to really identify earlier and help detect it and get those people in isolation and start the contact tracing. So I think antigen testing is going to be another tool we have in the toolbox. Dr. Rattay and Dr. Pescatore, it's one of those things that we just have to continue to, find and make sure it has the right spot that we use it. So again, thank you to the, the staff and all our partners, whether it's the National Guard, Newcastle County with, the county executive working with his testing team, and those at DEMA and public health to make sure that we're able to be out there and not doing, several hundred events the last month. So Governor, back to you.
Thank you very much, AJ. And to those of you, we would recommend that everybody follow the mitigation measures that Dr. Rattay talked about, particularly as your families gather and look to get tested to as part of that to protect those who are coming in, those in your family circle, particularly when you've got households that are mixing. Important to follow those mitigations. I would pull out that slide from the presentation today and talk to your family members with it. Look at testing sites that are available out there and work in testing to protect your family and particularly vulnerable populations. I'm going to see if we can get two of the charts. I just want to underscore this point about what we can't afford. We got really good news today, and with vaccinations happening, we've got the effort on Christmas Eve to salute our hospital workers by ringing the bells there on your front porch. But I want to show the two charts again, if I can get them up on the screen. The one where we see the all data hospitalization chart, where you see the run up in hospitalizations back in the spring, then the improving conditions over the summer, and then again this most recent run up in hospitalizations to the peak that we've seen yesterday at 433, and recognizing that we can't afford another peak on top of this. We said for some time that hospital capacity, although it is a moving target based on other folks that are in the hospital for different reasons, and efforts that the hospitals are taking to empty out the hospitals, if you will, as well as the effectiveness of moving patients along out to assisted living facilities. We've helped the hospitals with that, working in partnership with Genesis to move some of the elderly populations out. But you'll see as you run up, if we can get that chart up, the run up to the peak recently as a result of social activity around Thanksgiving, that we can't afford to have a peak on top of that. And by the way, many states did back in the beginning of the summer. When we followed the CDC guidance here in Delaware, we had 14 days of improving conditions, a reduced number of positive cases, a reduction in hospitalizations. We opened our economy in sync with those improving conditions. In other states, they did not do that, and so they had peaks on top of peaks, and that's what we need to try to avoid now. And the way to avoid it is for all of us to look at our family situations, use the guidance that was provided by Dr. Rattay to protect one another, limit exposure among households, Be careful when you're out in public. Limit trips out in public where you know you're going to have a difficulty staying separate from one another. So I don't see that chart. Maybe we can come back with it later. But no, here we go. We're going to get it right here in a second. And you'll see what I'm talking about. You had the peak back in April, May. There it is. And you see the run up here from the 1st of November to the 3rd week in December here. And we increased by, 4 times. And you can see that visually, you can see the graph and the acceleration of those hospitalizations. Really, this is the thing that we focus on all along, why we have the mitigation efforts in the first place, because we don't want to have people who need hospital care and can't get it. We know our hospitals are doing everything they possibly can to make sure that there's space when somebody presents and is tested and is COVID-19 positive. This is what we can't see another peak on top of that. If you can move forward to Dr. Rattay's chart, which is showing a little bit of a flattening now over the last several days. There we go. You can see that run up, really a very sharp run up there after Thanksgiving. This is positive cases. So what follows positive cases with a lag is the hospitalizations that are necessary for those who get to be positive, right? So you see positive cases flattening out. Behind that in another graph is hospitalizations rising. What we can't see is another rise in positive cases after Christmas that will, into January, create a rise in hospitalizations that the hospitals will struggle to meet. We're going to do our level best, the hospitals will, but you can do your part as well by being careful, by getting tested, by particularly getting tested, folks who are coming in from out of state to get tested and to abide by those protective measures that Dr. Rattay went over. So with that, we have media I know that have been let in and joined us on this Zoom call. I don't think we've had any pre-submitted questions. We don't need them now that we're on the Zoom. So we'll open it up to any questions from the media. Again, thank you to all of you who have joined us today. And we look forward to the questions from the media.
All right, first we'll go to Sarah Gamard from the News Journal.
Hey, Governor, can you hear me?
I can, Sarah.
Governor, with the changes that hospitals are making, what is the current hospital capacity?
Yeah, well, we've said that's a moving target from the beginning, that my estimate, that the working number that I've always used is between 400 and 500. We're at 433. One of the things that I'll turn it to AJ and he can go through some math that has gone through recently. We know the hospitals are managing their side of it as well. I mentioned that in terms of pushing off or eliminating elective surgeries. We've seen a decrease that's happened in emergency room visits. Mostly, I suspect people choosing not to go to the emergency room. Some of these things are not always positive, as we've mentioned before, people delaying treatment that they should get. And so it is a bit of a moving target. AJ, do you want to put that in context in terms of total hospital census that you've looked at?
Yeah, so we've been working closely with the hospital groups since really March to try and model as much as we could to help them prepare and make sure resources were allocated as best possible. And so even with this, the post-Thanksgiving spike we've seen, they're still not, if you look at the numbers yesterday, the 433, I believe, it was still about the 20th busiest census day of the hospital since we started back in April tracking this. So they have a lot of levers they're pulling on their side, as the governor referenced, postponing some non-emergent surgeries, et cetera, making sure they manage with their staff. The other thing we heard through our calls, our weekly calls with the hospital leadership is really the addition of the vaccine coming in is going to help them long-term, as well as the changing in the CDC guidance of the quarantine for those that were exposed from the 7 to 10 days or from the 14 days to 7 or 10 if you had a test at 7 days with no symptoms. So that's going to help them get a large number of their workers back, because that was the limiting capacity. It wasn't the beds, it wasn't the floor space. It was really, do they have the medical personnel available when needed to respond to that? And so we've also assisted. Dr. Rattay and I signed a health order back in the spring, and then again a few weeks ago, to allow retired professionals back into work in the state, or those from out of state without Delaware license, an expedited process to be able to work here, as well as some medical students. So, it's a partnership with the hospitals in the state to make sure we do everything we can in our power to help them succeed. And that's what we get out of the weekly meetings. There's no magic group of nurses and doctors that we're going to pull in from anywhere across the country. Every state's in the same position right now. So it's, what can you do internally to manage the risk, lower the risk, which is the orders the governor has given, as well as making sure the hospitals work across the systems. And we're lucky to have great partners throughout the state.
So just to underscore a couple points, staffing is the limiting factor. Staffing levels have improved considerably as a result of the change of the CDC guidance with respect to quarantining. As I think about the numbers shared this week, in the order of 25-30% better with fewer people on those quarantines. And I've not seen specific data, but they report length of stay for COVID-19 patients that is less than what it was back in the spring. So all those things are adding up to capacity that they have now that they wouldn't have had in the spring.
Governor, Congress has extended unemployment benefits through its new relief bill, but the Labor Department in Delaware says there might be a lapse of benefits for people who have to re-enroll because the department is transitioning from the current program to the new one. Do you have a message for the thousands of people here who may face a lapse in unemployment benefits and worry that they're not going to be able to afford it?
Yeah, we're going to do everything we can to avoid that, or to get it to them as quickly as possible. Obviously, we didn't have any control over the timing of the action taken by the Congress. We would have preferred it would have happened sooner. It's happened. That's a good thing. And so help is on the way.
All right, next we will go to Amy Cherry with WDEO.
Thanks so much. Governor, I realize that the vaccination plans are really still evolving, but I'm wondering if you envision educators being vaccinated before they return to the classroom, and if not, whether you're still comfortable with that mid-January return.
Yeah, I'm comfortable with the mid-January return, whether they're vaccinated or not. We'll have some information to share with you probably next time with respect to a study that's out of the state of Mississippi that bears out what we have learned. Obviously, vaccinating teachers is an important priority for us to help with the objective of creating a comfort level for educators to move back to in-person instruction. We know that remote learning has a very negative effect on children, and that they are losing precious days of instruction as a result of that. And so we're all hands on deck. We're using this pause we've met with just about all of the local teacher organizations to answer their questions, to try to get to a comfort level, to address operational issues. And there are operational issues, meeting and speaking with the superintendents on a weekly basis as we do. We believe that the vaccination of educators and teachers should be a priority for the goal of making sure of getting children back in front of teachers for in-person instruction.
Thank you. Second question that I had was, we've heard that hospitals are currently managing the numbers that they have, but as you said, they can't afford that surge on top of surge. I'm wondering if you envision needing those additional stand-up hospital sites that were established early on in the pandemic, or whether plans are underway to begin standing those up.
Yeah, I hope not. I think what we're steering towards instead of that, by the way, is facilities within a facility. Each of the hospitals, Bay Health in particular, I'll take it because it's most relevant. Number one, we have partnered with Genesis to provide beds to release some of those elderly patients too with assisted care. There are facilities within Bay Health in Kent County and in their new facility in Sussex County to direct some of these patients into opening up specific COVID-19 treatment opportunities. And so they're doing things more creatively within their buildings and their facilities that is achieving the same objective. And if you think about it, if staffing is your limiting factor, which it is clearly, moving staff or opening up a new facility that will require maybe additional staff because you don't have the spillover support is not as effective as being able to stand up something within your existing facility. So that's something that we've learned. I don't know if Dr. Rattay wants to expand on any of that, but they have come up with ways of creating additional space, basically moving patients through better treatment, shorter stays into other arrangements that free up some of that critical care space. And AJ talked about the overall census being down, which enables that to occur. Dr. Rattay, anything else on that?
The only two things I'll add is on the prevention of hospitalization front, the monoclonal antibody, the strategy to really get monoclonal antibodies to the people who need it is, potential good strategy to help prevent some people from ending up in the hospital in the first place. And then vaccination of healthcare workers, it just couldn't come at a better time because within several weeks, at least they will have some immunity. And so, with the goal of decreasing staff shortages, every little bit can help.
Yeah, that monoclonal antibodies is a really important point because in the report yesterday, they're treating, I'd say, dozens of folks kind of statewide, maybe a little bit more than dozens. But in each of those, these are by definition individuals who are in that elderly, vulnerable population who are likely to, in fact, they reported that some, they didn't get to them soon enough and they did need hospitalization. But those are, dozens of patients that otherwise may have needed hospitalizations that are not going to need it as a result of this treatment, which we did not have in the spring.
All right, next we will go to Roman Battaglia from Delaware Public Media.
Hi there, Governor. My first question is, has the turnaround time for testing, delivering the test results to people been disrupted by the strain on the U.S. postal system from holiday, deliveries and also just the high demand for testing right now?
Yeah, we've had some fluctuation there. It was an area of concern. AJ's got a full handle on it. I'll turn it over to AJ.
So, no, thank you, sir. Good question. So, the testing increase or the response increase that we saw for people actually getting their test results back was specifically to the demand for testing. If you look at some of our numbers pre-Thanksgiving, we were averaging probably between 3,500 and probably 5,500 tests on our busy days. And that week before Thanksgiving, we had days in the 13,000 range. So I think our low water mark was the Wednesday at 10. Monday and Tuesday were both at 13 and 11,000 respectively. So with the increase of testing across the country, with us almost doubling our testing numbers for a few weeks, that created a ripple effect down through the labs. So it did not have a impact from actually the postal system or couriers. We actually have worked with Curative, and they have private couriers that are at the sites, so at any of the large drive-thrus or at the trailers at the end of the day to pick up those samples, and they get brought down the lab. So they're at the lab within a few hours after the testing site closes.
And my other question is about the CARES Act funding. I know you mentioned a little bit about the federal spending bill, but we know that it is going to allow for CARES Act funds delivered to states back in March to be spent for the rest of next year. What is that going to mean for, these funds and for the state in terms of spending that money. Was there a lot of money that the state wouldn't have been able to spend from the CARES Act funds if this deadline wasn't extended?
Yeah, there was some amount that we would not have been able to spend. Most of it has been allocated. Some of it has not been distributed, if that makes sense to you. In other words, we've allocated it to a program. In fact, I mentioned today another slug of money going to hospitality businesses and others that received CARES Act relief funding, a 20% bonus for those and 50%, another 50% for hospitality. Hospitality has been ravaged by the shutdown orders. And so we've tried to help them as much as we can, and we have. And we've got another slug of that money that's been coming. So it'll enable us to move that money through and not risk having to refund it. The money's been already months ago been transferred over to the state account, but anything that was spent after December, we would have had to reimburse the U.S. Treasury. So yeah, there are significant dollars. I would say in the $100 to $130 million range. Some resources were at Newcastle County that the county council had voted to reimburse the state for costs associated with really important programs like unemployment insurance and like testing and child care facilities, early education facilities. And so, yeah, this will give us an opportunity to support some of those businesses that have been critically affected, negatively affected.
And next we have Tim Mastro from Delaware State News.
Hey again, Governor. You hear me?
Yep, Tim, you good?
All right. As the year is kind of coming to a close, we've heard a lot about this virus, and something that really stuck out to me was talking to Dr. Hong about a month or two ago, where he said the misinformation around the virus is as dangerous as the virus itself. Curious, what's the biggest piece of misinformation you found yourself kind of fighting back against, both on the public policy side and the public health side this year?
Yeah, I don't know the biggest challenge with respect to misinformation. I'll let Dr. Rattay and Dr. Hong handle that. I think the biggest challenge that we had is the tension between individual freedom and liberty and public health. We know what protects public health, and it's for everyone to wear a mask, to social distance. And when we had to shut down areas of the economy, to shut down, when we had a stay-at-home order to stay at home. There are lots of our neighbors who believe that they have the right not to do that if the governor or government tells them to do it. And that's the most challenging thing, I think. It's more of a political question than one of public health, although there is a public health aspect to it. Many of those folks have told me they think the whole thing's a hoax. Well, those 433 people that are in the hospital right now don't think it's a hoax. Those 879 people who passed away and their families don't think it's a hoax. It is not a hoax. The millions of people who've died, I think it's an insult to them to say that this is anything but a very serious pandemic. We've taken it seriously from the start. We have followed the advice of the CDC, the White House Task Force, our own public health experts, Dr. Rattay, Dr. Hong, and their staffs have done incredible work. Our hospital partners, they don't think it's a hoax. All those hospital frontline workers are getting their vaccines. They don't think it's a hoax. They've seen the pain, they've seen the suffering, and they know that it's real, it's dangerous, it's deadly, and people can do their part by following the really basic instructions, which, by the way, weren't really clear at the start. Initially, there was equivocation around wearing a mask or not. We quickly learned that it was the most important thing that you could do. And that's why people doubled down on that. And that's why we put in place mandatory mask wearing orders. Dr. Rattay, Dr. Hong, anything on that question?
I think I'll hand it off to Rick, because my guess is he had some pretty specific examples of misinformation. But some of what goes out there on social media, and some of it has been politically driven, which is really complicated the ability to just have a sound, common sense public health response at times. I think for the most part, most people want to do the right thing. I've heard repeatedly from people who have become infected say, well, we didn't really think it was going to happen to us. And so, what we talk about on a regular basis around the importance of wearing masks and social distancing, maybe we didn't know as much in March, but we know enough now to say, those are the keys to making a difference and to keeping us, safe while we get through this. Dr. Hong, do you want to add anything?
Sure. I mean, I think, thinking a month ago, and that seemed like forever, that, the mask issue was one of the things I was thinking about, that the mask is effective. And, all these measures we're putting in, we realize it's an imposition, we realize it's uncomfortable, but it's effective. But I think one of the other things I want to mention, I'm still getting these inquiries, someone who's asymptomatic without symptoms, and they get a positive test, and they're assuming it's a false positive. So we want to stress that, we are seeing asymptomatic spread, that you can be positive without symptoms or mild symptoms. So don't blow off that positive. There's a reason why we are asking for testing in the asymptomatic population, because of this asymptomatic spread threat. So if it is a positive, you should treat it seriously and not say, well, it's got to be wrong because, I'm not sick. So I think I like to push that message forward with your question. Thank you.
Great. And then my second question, quickly on long-term care. I noticed the weekly update DPH sent out. That list has, I think it's around 20 centers. I know that's a cumulative list, but just curious on what contact tracing or research has showed of how the virus is still getting into long-term care facilities.
Yeah, I can take that one. As we have seen, such an increase in community spread post Thanksgiving, it's not surprising that people who work in or go to, and really right now it's mostly people who work in long-term care facilities, are, not intentionally, but are bringing it into the facility. So what we're seeing in the facilities really is a reflection of those, much higher levels of community spread. The long-term care facilities are doing a good job with testing staff and trying to get people quarantined more quickly, but it still goes to show you just how easily it can spread in those facilities once it gets in.
All right, thank you.
This might be a good opportunity to just add, I think this is a reason why we are so excited and eager to get vaccination underway in the next few weeks among staff and our vulnerable long-term care residents. This is one of the most important parts of our mission.
All right, we just have a pre-submitted question from Kyle Johnson at WBOC. This is the last question we have time for. He asked, given Delaware's small population, could we possibly move through our distribution phases and reach herd immunity more quickly than other more populous states?
I'll turn that over to the two experts on that one. It seems to me we're getting an allocation of vaccine that is proportional to our population.
Yes, Governor. And we would love to say, because we're a small state, we've got an edge on other states. I think a reason we might have an edge on other states is because we have a great relationship with the partners that are involved in this complex execution of vaccination, but we're getting the same amount per capita that other states are getting. So, we don't expect that the number of vaccines is going to lead us to herd immunity sooner. Dr. Hong, I don't know if you have anything to add to that.
Yeah, I think there's many factors involved. It's not just the size of the state. Looking at density would play factors as well too, and compliance throughout the state. So it would be great to say that we're going to beat this quickly because of their small size, but we have to look at the other factors as well, and that's why we are still pushing for compliance with these infection control measures as we continue with our vaccination journey. So I think it's wishful thinking. I wouldn't put my money on it though.
We do tend to be one of the best states for vaccination rates in the country. So we hope and pray that we follow that same pathway for the COVID-19 vaccine.
So if any state can do it, mighty Delaware can do it. We're small, but we know each other, we hang together, and we work well with our partners. It's a little bit easier, I think, to work with our partners. So hopefully we'll be able to get to hard to reach populations, a big concern of all of ours. Obviously we have an effective vaccination program that predates COVID-19 for other vaccinations, and we'll build on that and try to do it as quickly as possible. So again, today we had good news that the vaccines have arrived, and vaccinations are taking place in our hospital populations. We have a celebrate of those hospital heroes, our healthcare heroes, on Christmas Eve, December 24th at 6 p.m. That's Christmas Eve, December 24th at 6 p.m. Ringing the bells, taking the lead of Newcastle, Old Newcastle, Mayor Carney and his council, passing the resolution over there. Hashtag ringing bells DE, hashtag ringing bells DE. Join us on Christmas Eve to celebrate all those frontline workers. As I do that on my front porch, I'm going to be thinking about our team, Dr. Walker, Molly McGarrick, Dr. Rattay, Dr. Hong, Dr. Pescator, AJ, all of our frontline public health workers who've been on the job on this for the last 9 months. Feels like 9 years, I think, for all of them. Again, doing a tremendous job. I'll think about not just the frontline workers at the hospitals, all of our hospitals and those that support them, all our primary care physicians, all our healthcare workers, all our first responders and police and fire and paramedics, all the folks across the great state of Delaware who make our state safe, are going to help us all get vaccinated. We invite anyone who has hesitation to contact us with questions that you might have. There is the hotline that Dr. Hong made available. Come get the information that's on our new website. Log on to our new website. It's the same address, de.gov/coronavirus, de.gov/coronavirus. Testing, vaccination, following the spread in communities across our state, My Healthy Community tab. Give us some input for things and questions that you have. And we look forward to all of us having Merry Christmas, Happy New Year. We'll see you before then. But look at those mitigation strategies that Dr. Rattay laid out and shared with us today. We've got testing sites to enable you to test those that are coming into your household, those who are traveling outside of our state. Please be safe and help us get through this. Thank you very much. We'll see you next week.